Balls Deep.
Welcome to Balls Deep, a humorous yet informative medical show with a mission of optimizing your performance in the bedroom, the bathroom, and the boardroom. I'm your host, Dr. Joe Pizzona, a board-certified urologist and CEO of Pizzona MD. We hope you enjoy. Now, let's jump right in. Stream team, welcome to episode 2 of everything you need to know about the new weight loss medications. I'm here with my disgruntled co-host, Miss Catherine Williams.
I'm a little disgruntled, but it's okay. It's okay. I was given some constructive criticism over my performance, and I didn't respond well. I responded rather poorly because generally the feedback that I receive is, you are great.
Well, you are, but
that wasn't the feedback that I just got, and I took it poorly. Hey, I'm going to get fired from this job this week,
listen,
for sure.
Oscar Performances had multiple takes. You know, if in Balls Deep we got to restart an episode, that's all right. So
I thought it was great. But anyway, we're here, and we're going to talk about these weight loss drugs some more.
Great. So I thought let's jump into, the top 5 things that people need to know about these weight loss medicines. The first episode was the who, the what, the how.
The facts and the information.
Yeah, but, there's a lot of kind of just, I want people leaving with like some actionable things, and like everything that is going on in healthcare, when it's put into the media, we take this one thing out, we portray it as X, and all of a sudden we believe that for the next 20 years as if we can't change our mind, or that is the fact as laid down by the good Lord himself.
Okay.
But rather, there are nuances to most of these things, and again, we want people
changing information, possibly.
Absolutely.
Okay.
So let's dive right in.
Let's go deep.
Balls Deep.
Okay. So the top 5 things you should know about weight loss, the weight loss drugs. Mm-hmm. First, you have said it is a tool. Tell us more about that.
Yeah. I can't stress this enough that, and I talked about in the other episode, we have such this mindset of just give me the drug. Give me the drug. It's all I want. I don't want anything else. I don't want to put any effort into doing this. Mm-hmm. And, the crazy thing about this drug is it works. So if all you want the drug, it's going to do what it's going to do. But I would argue as a healthcare professional, it's so much more than that. And by that, I mean this. First off, ideally, we don't want you on a drug or a medication the rest of your life. Like, people ask me all the time, well, if I stop the medicine, will I go right back to where I was? And the answer is, if you don't change anything else, yeah.
Okay.
You will.
Okay.
In fact, there's some information saying you might rebound to even worse. Okay. And so that doesn't mean we shouldn't ever prescribe the medicine to go, I got to stay on this forever. It should rather be, listen, I'm going to partner with a healthcare professional who is nuanced in how to prescribe this, because it's not just take medicine, shoot and belly, go about my day and not think about it. Mm-hmm. We're going to develop a wellness plan. We're going to work on all the pillars and facets of wellness, find the ones that are the most important triggers for you, utilize this medicine at the lowest possible dose necessary to get you your results, and that's how you're going to make a meaningful change. If you are just going to go to some med spa where they're hawking it at you while they're sticking your face with Botox, if you're just going to go on some online pharmacy because it's, quote, the cheapest way to get it, you're probably not going to get the results you're looking for over the long term. Anybody can lose weight in 30, 60, 90 days. Very, very few people can sustain that over the long term and build overall wellness. And that is so key. So if there's nothing else you leave from this today, this is a tool and we should treat it as such.
Okay. Meaning that, yes, use the drug if you and your healthcare professional think it is right for you, but you also are not off of the hook of changing and dialing in your healthy eating and your exercise and your movement. Yeah. You take the drug and you don't do those things, are you saying you're probably going to end up in the same place that you were before you started the drug?
Listen, drugs save lives. Don't get me wrong. I mean,
sure.
if you have cancer, chemotherapy can be the difference between you sticking around another 10 years and you no longer being with us. There's no doubt that medications can help prevent that second or third heart attack. I'm not saying drugs by themselves or medications by themselves are bad. What I'm saying is we have this sick care mindset in the US. I am sick, give me a pill, change nothing else. Or I'm interested in changing, but you as my healthcare professional don't have the time nor the expertise to change it.
Or to help me understand what I need to do.
Correct.
Okay.
Because our entire system is built on sickness. What I'm suggesting as an alternative, what we are building with our practice in 2025 is one built on wellness. And there's lots of other practices doing this on longevity, however you want to label it, wellness, longevity, healthcare versus sick care. It's the same tenets. 80 to 90% of chronic diseases are diseases of lifestyle. You are doing something on a routine basis that is leading to these illnesses. Stop just popping the damn pill and thinking like the disease is gone and you've treated it. Get to the root cause. And these medications can be a very powerful tool to help you on that journey. So I'm not saying not to use them.
Right.
What I'm saying is don't look to use these by themselves and say, I don't want to do anything else.
Okay, that makes a lot of sense. Can I ask one question that's a little unrelated? You just touched on it a minute or two ago, and I've heard this from a few people. Getting too much of this medication? Like I've heard of some people saying they felt like they got sick and they felt like they may have been given large doses that may have been too large initially. I know that's not really related to our top 5 things, but how do you know where to start?
Well, great question. And I'm so glad that you brought this up. So there's, I think, 2 main points to get across. So number 1, it just further proves my previous statement of
You got to
partner
work
with someone.
somebody.
You got to work with somebody because you don't know. Number 2, this is why I am much more in favor of the compounded versions of these medications than the expensive name brand ones.
Why is that?
So one of the reasons obviously is cost.
Price.
Okay. So
Big difference.
big pharma is cashing in, baby.
Big time.
They want their money.
I mean, some of those name brands are exorbitantly priced. I've heard well upwards of over $1,000 a month.
Oh yeah. Yeah,
That's
absolutely. And listen,
huge.
In the whole scheme of things, I mean, that's not that much compared to the cost of dealing with all these diseases down the road. I mean, if I can prevent a heart attack or a stroke, we're saving hundreds of thousands of dollars.
Okay.
But number 1 is cost. Number 2 is that exact reason. When you look at the dosages of Wegovy and Ozempic compared to what we start at with our practice on the compounded version, they're massive doses, especially the Wegovy. I mean, it is many, many multiples above what we do. So some of
Really?
these people get the name brand, give them the shot and go, oh my God, I felt terrible. Didn't work for me and I'm done. And they then think that all the weight loss medications don't work. No, you just didn't get the right dosage. So that is so key why you've got to get with that right professional and why I'm much more in favor of getting the compounded medicine for most people.
Okay,
Yep.
great to know. Thanks for talking about that. Second thing we were going to mention on the top 5 things we should know about these drugs, you can lose muscle mass. Tell us a bit more about that.
So we see for vanity perspective, a lot of, especially women, going on these medications. And we've heard of the sort of Ozempic face that people are getting, right? And it's simply they're just losing all of that fat in their face.
They're looking a little sunken and really, really skinny.
Absolutely.
Okay.
But more important than the vanity portion of it, I would argue, is the potential loss of muscle mass. And I think, again, women are much more prone to this than guys. So not all weight loss is fat. People think like, I'm going to do a fat burner. I'm going to just target my fat. It doesn't work that way. I've had a great experience working with a local gym here, Paragon Strength and Fitness in the Nashville area. And I really wanted to take my workouts and what I was doing that next level because, listen, I don't lack information. I need someone to hold me accountable and I need someone to look beyond my biases and say, well, what's going to work for Joe Pizzona? And what's been interesting is we do regular body composition testing. So this isn't just jumping on the scale and going, weight's down 10 pounds, doing awesome. It measures your body fat percentage and your skeletal muscle mass. And I will tell you, despite being incredibly regimented And you know
and
this.
he is.
And
It's
you know this, right?
unbelievable. It's wow.
Incredibly regimented. And over the last, say, 9 months that I've been working out with them, and I've probably done about 10 of these body compositions, there has been one 3-week period where actually I put on muscle and lost fat simultaneously.
Ooh,
That is
okay.
incredibly, incredibly hard to do. Either you are building, which is called anabolic, or you are cutting, which is catabolic. Okay.
Okay.
You're either building or you're cutting. And if you're cutting calories, if you're cutting weight, you are cutting muscle in most cases. So how do we limit that muscle loss? And we're going to get into a future episode why muscle mass and strength is so important. But
Okay.
let's just leave it as a cliffhanger. It's really damn important for your health. So we do care about muscle mass. So, especially with women, if you're going to calorically restrict and you're going to be on these medications, it's exceedingly important. One, you eat your protein first. And I know you hate that I'm on this soapbox, but
I don't hate it. I don't know if other people have this. It's very difficult for me. I'm not a lover of meat.
I'm not talking about you right
No,
now.
but I'm just saying it is hard. And I think I'm not the only person who struggles with getting an appropriate amount of protein. I am a big time exerciser. I do a good bit of weight training, but I struggle with getting a reasonable amount of protein.
So you take a woman like you or similar, and then you put them on these medications, and they're going to struggle even that much more. So, ladies, it's not just about the number on the scale. So here are my recommendations about this. Number one, if you are under muscled, this is probably not the right first step for you. I would
Okay.
rather we actually build muscle, put on some weight, and then work on burning off the fat in a more slow, sort of intentional sort of way. Okay. So sometimes the best way towards wellness is actually eating more. It's not
But eating more
less.
of the right things.
100%. So, again, nuanced discussion, but what I want people to leave here with as one of these top 5 points
Sure.
on these medicines is you can lose muscle mass. So, eat your protein, lift weights. And for our patients who, again, typically are female, who may be overweight and need to lose 10, 20 pounds, and we'll get into kind of that discussion, you have to prioritize the protein and you've got to lift the weights. That's a non-negotiable when you're working with us, because what we don't want to do is create a bunch of, quote, thin or skinny, brittle people. We want you to be healthy, and the strength of your muscles and your bones really does matter.
Okay, that's great to know. Number 3, the side effects, the potential side effects. You've said there are some potential serious side effects. But, death, blindness, a few things I've heard about this. How worried should we be about these? Are these overblown in the media? Are these things that have happened to 1 in 5 people? These very, we're not talking about the constipation, maybe some nausea, some acid reflux, the very serious potential side effects. Thoughts?
So there's a couple takeaways I want from this, and it's all under the guise of every single medication has risks and benefits, and every potential and lots of medicines have potentially a lethal dose. Tylenol is probably one of the number one causes of drug overdose in this country.
Tylenol?
Because if you take more than 4,000 milligrams, it will cause acute liver failure and you will die.
From Tylenol? Okay,
So
I don't think a lot of people know this.
Take enough aspirin or ibuprofen and you're not going to do well. Okay. So everything is dose dependent. And obviously when you have something like an illicit drug, that window of where I can feel high and live and where I die is very, very narrow. And that's why we have all these awful fentanyl killings and so on. So point being, every drug has side effects. Now, unfortunately, when you have something new come into our culture and society, we tend to overestimate the downside and the risk, sometimes as much as we oversell how great it is, right? Mm-hmm. This is the best thing since this. Oh, but this thing's going to kill you. You can look at I was talking to you beforehand, sort of the self-driving car, right? One person dies from a self-driving car, and this is, who would ever want this?
This
This is
technology
terrible.
is awful.
It
It's going to
doesn't
kill
work.
us. It's crazy. Right.
40,000 people a year die in this country because of human errors while driving.
True.
But we don't bat an eye at that.
Right.
But the one person died from that. It's the same thing with these drugs. Again, we're going to totally ignore the fact that obesity is slowly killing this country and most of us and most of our loved ones. And yet, if we hear one report of someone taking Ozempic and they die, we're all in a tizzy. Mm-hmm. So here are the things you need to know. Yes, we have seen some reports of sudden blindness. We don't know the incidence, but it seems to be rare. Stay tuned. In terms of the deaths that have happened, this is the scenario. Because it slows down the emptying of food from your stomach, if you are on these medications and you were to undergo a surgery, you are at a higher risk for something called aspiration. What is that? It is when the contents of your stomach come up your esophagus and then go down the wrong, quote, pipe, gets into your lungs. If you get food in your lungs, it's really, really bad. Even a healthy person can die from that. That's called aspiration pneumonia. Okay. Ooh. Again, an exceedingly rare situation. But if you're going to undergo an elective surgery and you're on these medications, you should stop them for at least 2 weeks. Okay. So there's, again, reports of gallbladder attacks and inflammation of the pancreas, which can make you very sick. But it's one of these things that you just need a couple people having that, and you're missing the fact that millions and millions of people are benefiting from it. So this is where the U.S. gets it wrong with statistics. This is where we get it wrong with sort of the media portrayal of a lot of things with healthcare. Okay, these are important medicines, but every single medicine, whether it's Tylenol to fentanyl or Ozempic, all have potential risks.
Okay, very good to know. Number 4, you've said put your ego aside. What do you mean by that?
We have encountered even amongst some friends, right? And I see it all the time with patients who come in the clinic who come in who clearly are struggling, in various
with their weight
stages.
Loss,
yeah, various
health.
stages, whether they're 15 pounds overweight and that's causing depression and other mood disorders, or they're 100 pounds overweight. And very often I hear I want to do it natural.
Naturally. Oh, okay.
Right.
Okay.
And listen, if there's any traditionally trained doctor who's into holistic whole body ways, it's this guy sitting right here. I'm all in favor of it. There's so many things that traditional medicine doesn't do right. But again, when your ego comes into play to think like you're, quote, not good if you use these medications, or you're just not disciplined enough.
You've cheated.
Or you've cheated and you've got to prove something to yourself or others. Where does that come from? How does that serve you if in the end you're still against the same struggles everyone else is? I mean, listen, weight loss and wellness is incredibly simple, but is also exceedingly difficult.
It's not easy.
We know what we've got to do, but it's so difficult because of societal cues, because of messaging, because of our environments, because of habits, because of just our biology. I mean, again, I pull this analogy all the time. We're hunter-gatherers, okay? We are meant to move our bodies, and our job is meant to do the least amount necessary to survive. Well, tens of thousands of years ago, that meant we went hunting for our meal or foraging it. Otherwise, we'd die. Now, you can literally sit your ass on a couch all day, and if you have a phone, be fed 24/7.
Mm-hmm. You don't have to leave the couch.
So again, people, there shouldn't be ego involved with this. Like, you're not a bad person if those things, you succumb to them. No, you're a human being. And so when I say put your ego aside, listen, obesity is slowly killing you. Being overweight is slowly killing you. You may not feel it now if you're in your 30s or 40s, but trust me, one day you will. Mm-hmm. So why would you not take something that has proven to be safe and effective? And let's go back to our last episode. Guess what? It's a hormone that's already in your body. It is, quote, natural.
It is natural.
I'm not in favor of throwing the GLP-1s in the water quite yet and having everyone drink it. But at the same token, if you are really struggling And again, these things are difficult and you need that spark to get you going. Boy, why not go on this medicine even for 90 days, help it kickstart all these habits. And the beauty of habits is once you have good ones, they're just as powerful as bad ones. I mean, people, you guys poke fun at me and other people do, and I'm totally fine with it. Like the other last night, we're there in the living room and I'm getting down the ground doing push-ups.
He did this. He does this now, and it's sort of odd, but he's going for it. I am not.
But here's what I want to say in that story. It's not a humble brag. I don't have any more discipline than anybody else. Mm-hmm. What I have done over the last 15 years of my life is slowly and steadily put in various health habits to get me to the point where I can't not do that. I know that's poor grammar, but I have to do it. I have to go move several times a day. I have to go and walk because I feel better, because it is now a habit that I really enjoy. Mm-hmm. But again, if you dial back 15 years ago, I wasn't doing any of this crap. None of it. I was going to the gym, but I was also having a glass of wine every night with dinner. I wouldn't just have one cheat meal. I'd have 5 cheat meals a week, but I also wasn't feeling great. But I didn't change it overnight. And I'm not expecting our patients or clients to change it overnight either. So just put that ego aside. This is a marathon. This is your life. This is your wellness. And again, it's a tool. It works. Who gives a shit what it took for you to lose 20 pounds? At the end, if you lost 20 pounds and you're a better version of yourself, that is fantastic.
And you feel better.
Yes.
And you feel better. Okay. I'll take that. The last thing you mentioned, and I think this is good, be prepared to change your mind, which is a little different than what you were just saying. So what do you mean by that?
Yeah, so when we look at these medications and we go in again with this absolute mindset, good versus bad. Yes, I should be on it. No, I shouldn't be on it. They've taught us in medicine and when we're going through medical school, I want all of you to know that over these next 4 years, you're going to learn a lot of information. You're going to dedicate the next 4 years of your life on the start of your medicine journey and learning things. That's the good news. The bad news is 50% of what we tell you today is going to be wrong in 10 years.
Because it all changes. You get new information?
Yes.
Wow.
And that is not the American way. You're either right or you're wrong. You're either going to heaven or you're going to hell. You're either good or you're bad.
We're not good with the gray area.
Not at all. But science isn't about truths. Science is about having a hypothesis, testing it, and then as new information comes in, retesting it. I mean, there are a myriad of drugs that were given to people in the 40s, 50s, and 60s that we go, you gave people what? And we now know is dangerous. But in that moment, based on the information we had, we thought they were really good things. And so with all that being said, what we know in 2025 is that these weight loss medications are powerful drugs that when you partner with the right healthcare professional could be a tool that could lead to some big changes. Okay. But I'll give you 2 sides of the equation. One, we may find that the incidence of blindness is really damn high and not worth this medication. And it could be off the market in 6 months.
Okay.
I have no data to say that. I don't want this taken out of context saying that that's going to happen, but it could. On the flip side, we're studying it for alcoholism, dementia, cancer, cardiovascular risk factors. I mean, it may be that we're going to want to start giving this to our kids because this is the longevity drug we've all been looking for, and it can prevent all of these awful diseases. Either of those are possibilities. Now, probably not. I'd put a low percentage on those 2 extremes. But the point being, what we know today could be false down the road in either direction. So when you are making healthcare decisions, this is why it's so important to partner with the right healthcare professional and make an informed decision with the evidence that you have in front of you today, but always be prepared to change your mind. And it also shows why it's so important to treat this like a tool and not that miracle drug I'm just going to take the rest of my life. Okay? Use it as something to kickstart better wellness habits, and that is going to be the most effective use of these class of medications.
Okay, that's great. But you still, even all of that being said, you still feel that this is a great, I'd come up with a better word for tool if I could, but since we've used that word, it's a great tool and it's out there and you do believe in it, but not for everyone.
It will go down as easily one of the top 5 drug discoveries of my lifetime, assuming we don't find that cure for cancer we've all been looking at. But even if we do, when you look at the diseases of obesity, from cardiovascular disease to cancer to Alzheimer's to, again, even COVID deaths to diabetes to liver failure. The number one cause of liver failure now is a fatty liver. I mean,
Right.
we've cured, hepatitis C, and so, that'll be another, up there in the top 5 drug discoveries. So, yes, it is a absolute game changer, but it doesn't mean you should blindly just go get the medicine for the least expensive price and start jabbing it in your belly. That's why healthcare, that's why I went to school for 13 years after high school. It's why we do what we do. It's why we practice it's a science, but it is also an art. And there's no algorithm. There's no online pharmacy or, specialist you're going to dial up who's going to know the art of it, like someone who's sitting across from you and working with you on a weekly or monthly or quarterly basis to make sure this is the right fit for you. So yes, it is as good as advertised, but like everything, it's mainly in the gray area and not so black and white.
Okay, we'll take that. I'll take all of that.
Love it.
Okay, I'm going to bring it down for a little wrap up in my favorite part of the show.
Just the tip.
Okay, so just to recap, the top 5 things you should know about all of these weight loss drugs. Number 1, it is a tool. It is only part of what you have to do or you can do to get yourself into great shape, great health, feeling good mentally, physically, emotionally. You still have to do your work with healthy eating and exercise. Number 2, these drugs can promote a loss of muscle mass. So if you are taking these, you have to really double down on eating your protein, prioritize that, and also prioritize weight-bearing exercise, weight training of some kind. Number 3, yes, serious side effects are possible, but they are very rare and possibly a bit overblown in the media, but they're still looking at it. Number 4, put your ego aside. If this is a tool that can help you in a really serious weight loss struggle and your journey to health, and your healthcare provider thinks it's the right choice for you, try it. Getting healthy and getting out of the obese category is a win. Number 5, be prepared to change your mind. As Dr. P stated, drugs are always being reevaluated. New information is coming in daily, weekly, yearly, and be prepared for new information that may change what you think about it. Did I get it?
No, it's a great summary, Kat. And on that last point, where you get your information matters. And
absolutely.
And that is why we're doing this podcast. We don't live in the information age. We live in the misinformation age.
That's so unfortunately true.
Any one of us can go down some rabbit hole on a Reddit thread or a Google search or listen to some podcast and get some information, go, oh my God, I didn't know that. I really hope, and what we're trying to be, is that unbiased view at things as best we can. We all bring biases to what we say, but really stick to big principles. And, the more certain someone seems about something, the more skeptical you should be.
That's definitely true.
Whereas what do we tend to do? The more certain someone tends to be, we jump in even more. And there's countless examples of how that doesn't go well in life, whether it's in health or other arenas. So, I'm constantly humbled by being a healthcare professional in what I do. It's, again, we alluded to earlier that I say the 3 words, I don't know, quite often in my practice because I don't know everything. But hopefully listening to this podcast, you get some practical information and can hopefully move this towards your journey of wellness. And we want people doing better. That's why we're doing this. I'm not pro the drug or anti the drug. I'm pro wellness. and it's a tool that helps a lot of people towards wellness.
That sounds great.
Awesome. Well, Kat, thank you. We made it through the episode, and now you get your smoothie.
We did, and now I am owed a smoothie.
Yes, we're going to a nice brunch.
That was my payment for being here today. I got $10.
A nice, healthy brunch. So
I'll take it.
Absolutely. Well, Stream Team, as always, thanks again. Please hit that subscribe button. Please share this with other folks in your network. We want to get this information out there so people can get the right information instead of misinformation. So on that, please show yourself a little bit more love and kindness. We are all works in progress, and these are opportunities to grow. Thanks, and have an awesome day. Bye.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our Stream team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Pizona MD, please visit PizonaMD.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.